As a pediatrician, I've been very fortunate to have trained at some of the world's best children's hospitals, including this one. And it's great to work here, isn't it? I mean, all these awards and the accolades, but more importantly, we really do provide the best and safest care for the sickest of the children in our community. And we also have fantastic training programs. We bring the smartest students from around the country here in a competitive practice, and they learn the best techniques for caring for those kids to achieve the best outcomes. Many decades ago, and when there were many fewer halls, I was one of those trainees to wander these halls, trying to do the best I could for children. And I was so excited. I really wanted to make a difference in the lives of my patients. I thought I would go out there into care and really change the lives of families so that children could grow up and live healthy, productive lives. And then I met Oscar. So Oscar was a 22-month-old called in as a motor vehicle trauma patient to the emergency room. We gathered the trauma team, went to the trauma bay, and awaited the squad car that had promised delivery shortly. But we were really surprised when in walked two policemen carrying a happy, smiling 22-month-old toddler. So after cleaning up some scrapes on his elbows and knees, putting Band-Aids on, I asked the policeman, so what happened? The police told me they'd been called to the local Walmart at 3 in the morning because a family had been sleeping in a rusted-out station wagon in the back of the parking lot. Parents in the front, 3 kids in the back. And when the police asked them to move along because they had been evicted from their home recently and had nowhere else to go and knew no one else in the country, started the car, tiredly rolled away, they did not realize that Oscar had stirred and broken through the rusted-out floorboards in the back of the car and rolled behind the car. So the family kept going, but the police saw it all, and so they bundled Oscar up and brought him to us. Now, Oscar's prognosis from his little roll with the car was great. He was going to heal from those cuts and scrapes, and we did a great job bandaging them. But Oscar's prognosis as a homeless child in one of our worst neighborhoods is grim. See, Oscar lives in one of the areas of concentrated poverty that we have in every major metropolitan city in the United States. They're areas that we call sick neighborhood syndrome. And Oscar and the thousands of other children like him that grow up in these neighborhoods and on this map in our city, they don't do well. Children growing up in these areas are 6 times as likely to be exposed to gun violence, 5 times more likely to be incarcerated, and 3.5 times more likely to die of infant mortality than their peers. In fact, the numbers are so dramatic effect on health that there is a 25-year life expectancy difference between Franklinton and Upper Arlington, a 28-year difference between the east side of Columbus and New Albany. In the last 20 years, we've learned a lot about the social determinants of health. And those are the factors that influence the difference, neighborhood by neighborhood, that we just talked about. And the social determinants of health have taught us that clinical care, the best clinical care in the world provided right here inside these walls, really only accounts for 10 to 20% of the health outcomes of a population of children in the community. Instead, it's these other factors, especially the social and economic factors, that drive the most important things that happen to children right now. Our biggest epidemics, obesity, behavioral disorders, suicide, asthma, those are all socially influenced and are not going to be fixed by steel and glass towers. Housing is one of the most important of those social determinants. And children who live in these neighborhoods have a hard enough time even finding housing. But if they find it, it's rarely affordable. And when it's affordable, it's rarely of high quality. So children are forced to confront broken pipes, infestations with rats and mice, lead, asbestos, and other traumas. So how did a system, when we've learned so much about what really matters to make children healthy, do such a great job focusing on what we do inside these walls, but not do so well on what's happening in the community? And I think 75 years ago, we had a healthcare financing system that was set up to provide catastrophic insurance but the system has not evolved to take into account outcomes for kids. So we still get paid based on volume, not value. We still get paid based on the size of our hospital, not the quality of the outcomes. We still get paid based on the amount of time and number of children I see. And I was one of those clinicians. I was seeing my our relative value units quota every week. I was prescribing albuterol to asthma patients going into homes infested with mold. I put Band-Aids on Oscar when he was homeless. But I continued to do so because I didn't know what to do about these big problems. And that was until I met Robert. Robert was an 11-month-old with failure to thrive who came into the clinic. His young mother had been bouncing back and forth between the homeless shelter and the apartment she shared with an abusive boyfriend and her 2 babies. And Robert was suffering the consequences and not growing well. And as I pleaded with her to increase his nutrition because his brain was not going to develop and he was going to be slow. And she said without hesitation and without any emotion, well, maybe that would be a good thing if Robert were slow, because then he wouldn't know the hell we live in. I realized that all of my prescriptions for albuterol and Ritalin and cortisol cream and Band-Aids for Oscar and Robert were not having an effect. And so I gave up my medical license and decided to focus on the social determinants of health as best I could. And what we've learned is we have the best prescription yet appearing. And housing for health may be the best prescription yet for sick neighborhood syndrome. So how does housing help? Well, housing helps children in 3 ways. First, healthy, affordable housing lets parents be parents. Instead of worrying about evictions and changing schools and paying the rent and being overburdened, parents can actually parent their children. Healthy, affordable housing also keeps children safe from rusted nails and broken steps and broken pipes, lead infestation and mold and other things. And thirdly, healthy, affordable housing can build neighborhoods too, so that we directly combat the sick neighborhood syndrome and build social capital in the community. Now, who's going to pay for that, Kelly, right? It's expensive. But there's people beginning to realize. So the Housing First movement, in a series of randomized trials around the country with a variety of very expensive medical and mental health conditions, has shown that people who are sheltered first, without earning it or deserving it or anything else, have much better health outcomes at much lower cost. And so what's happened in the past year? United Health has committed $400 million to affordable housing. Microsoft, $500 million. Kaiser Permanente, $200 million. Dignity Health added 1.6 to its 10 million last year. And we have joined 5 other hospital systems in a consortium of anchor institutions to improve care for children. You're probably familiar with our work on the South Side. Together with our partners from Community Development for All People, the United Way, the Mayor's Office, we're taking houses that were abandoned, often drug activity houses, and converting them into affordable homes for young families who most need it. And to date, the team here at Nationwide and our partners in the community have impacted more than 340 homes through grants to existing homeowners, complete rebuilds, and also affordable rentals. And there's more to come, because eventually what we're trying to build is a mixed income, sustainable community where no one is displaced or gentrified. But it's not enough to build buildings. You have to also build a healthy neighborhood, and we feel like we're well on the way to that. We have the first indications that crime is going down, that healthcare costs for the children in the neighborhood are actually being reduced, and that neighbors say they're more satisfied and excited to live there than they have been in our annual survey. So 30 years after Oscar and 10 years after Robert, we actually have hope that the best prescription yet for sick neighborhood syndrome is down the pipe. If we could find a way to provide healthy, affordable housing for more children and families, we'll not only have the best, and I mean the best, specialty healthcare system in the world, but we'll also have the best health for the Roberts and Oscars of the world. Thank you.